Local leaders focusing on the most vulnerable as COVID spreads in nursing homes. This comes as overall COVID metrics plateau and even decline. But once again, we are seeing this virus striking long-term care facilities hard. In North Carolina, we are seeing right now 256 nursing homes and 164 residential care facilities with ongoing COVID outbreaks. WCNC Charlotte's Chloe Leshner joining us live from Uptown to talk about what's being done to protect these residents. Chloe.
Hey, Vanessa, a lot has changed since the start of the pandemic. The state has identified the need for an added layer of support. So now when there's an outbreak in one of these congregant living settings, they'll send in reinforcements. Home to the most vulnerable community members has also been home to some of the largest COVID outbreaks throughout the pandemic. The latest wave hitting congregant living settings.
Those are not really sort of closed circles, those facilities, whether that's a nursing home or a long-term care or a prison. There are people coming in and out. So of course, what's happening in the community impacts what's happening there.
State epidemiologist Dr. Zach Moore says a long-term care facility will be added to the list of outbreaks if they have 2 cases over a 14-day period. The number of outbreaks right now on par with what the state saw during the Delta wave.
We're seeing a lot less severe illness and a lot less death, which is very encouraging. And that's because of the high level of vaccination coverage that we have.
The state now deploying regional infection prevention and support teams to help the local health department manage an outbreak. They'll identify opportunities for improvement and ways to reduce the spread.
So we have this level of support that honestly we've needed for a long time before COVID, but now because of COVID, we have this extra layer. And that really is reflected in seeing the smaller number of cases that are linked to these outbreaks.
And most of the residents in these long-term care facilities are vaccinated and boosted, but they were among the first to get vaccinated, and that protection does wane over time. Plus, we are seeing more BA4 and BA5, and those variants could evade some of that protection that we get from vaccines. Live in Uptown, Chloe Leshner, WCNC Charlotte.
Chloe, thanks for those updates.